Good afternoon, everybody, and welcome. It's great to see so many people joining us today. Wanted to introduce myself. I don't think I know everybody on the call. My name's Marie Hooper. I joined the Nasio team this year, and I am the UK Operations Director. So working in the UK to work alongside our supporters and raise funds for the work in Kenya. We're very excited today and delighted to have a good lineup of updates and speakers for you. So I will finish speaking shortly and pass you over to the team in Kenya. They are going to update you about what's been happening for them this year. And I'm sure, as I said, as we were waiting, you're going to have lots of questions. Please do share your questions as we go, type them in the chat, and I will be looking at those as we go through. And towards the end, we will have a Q&A session. So I'll pass those questions on to the team. But the team we have today, full perspective of the Nasio team. So alongside Nancy, we also have some other of our staff members who will be talking about our medical centre, our spirulina production, about our education and our social work, as well as some of the programmes and activities we've done during the last 8 months during COVID. They're going to update you about how the pandemic lockdown and the response by the Kenyan government has impacted them and their projects and beneficiaries. So you can hear directly from them. So we're very excited to have this set up. So the team will share their updates, and then afterwards we'll move into the Q&A session. So please do be typing your questions, as I said. We are recording this and I have muted everybody. So you won't be able to ask questions. Please do type. And if, as I said, if you can all make sure you're on speaker view, you should have a good, clear picture then of who's speaking, which will give you the best view. So that's good to see. And then at the end, I'll pass over to Nancy, who's going to close the session for us. So really exciting hour ahead of us. Before we begin, just a quick shout out to John and to Tony here in the UK, who've been amazing with logistical support, making all of this happen. All of the technical aspects aside, so we can bring all of the team together to speak to you. So thank you very much, John and Tony, for all of your help. And thank you to the team who you're going to hear from. So without much ado, I'd like to pass over to our team in Kenya. And the first person we're going to hear from is Ian, who's our head of education. So Ian, can you please give us your update?
Thank you very much, Chair, Madam Mary. I joined Nasio Trust this year, and it's been fantastic working with this great team to change lives for good. And it's worth noting that albeit joining this organization at the moment when we are having this COVID-19 pandemic, it's been a great privilege to our children and even our staff during this period, because during this time, our children have been able to be involved in learning sessions, and they have been able to get skills, hands-on skills, and also knowledge on matters to do with agriculture, tailoring, bicycle repairs, IT skills, and even health matters, because during this time, we realized that our girls and even our boy child have been susceptible and more exposed to dangers and other vices that may harm them. So our organization during this period has been able to ensure that our girl children are well protected, and up to date, we have not been able to report even a single case of early child pregnancy. And this is a good thing that our organization has done to the community. Now, during this period of the pandemic, and based on the fact that we are serving a community that is characterized by families that are very much impoverished, they are not able to meet their economic standards, we have been able to feed more than 200 children during this period, and we are still feeding them up to date. And it is worth noting that because their families are not able to cater for their meals, we have been able to cater for that, and therefore their health standards are can be measured, because it's something that if we could not have done as the Nasio Trust, we could not have changed their lives and their health status. Now, it's also good to note that during this pandemic, It has given us a good time to interact with our children. And during this time, our children have been able to gain esteem and what we call the efficacy. They are able to face life challenges. We have taught them how to maneuver in life, how to interact with their peers, not to interact with their peers negatively, but rather positively to ensure that they grow as per the societal norms and traditions. Nasio Trust has really changed life. And during this time, we really appreciate our friends for their good support that they have rendered to this organization. It's a thumbs up.
Thank you. Thank you very much, Ian. That's fantastic. And now we're going to hear from Spacious, who's a member of our social work team. Over to you, Spacious. Thank you.
Thank you. I'm Spacious Kongere and I work in the social work department. So from when we started with the pandemic, we are engaging our children. First of all, we are doing sessions with our girl child and also the boy child, sessions on guiding and counseling. Apart from that, we are also having sessions on child protection, where we are telling them the importance of the children's rights and how they're going to protect themselves from any harm and how to report if any harm happens to them. And from that, we are also doing home visits and home follow-ups and child updates. So through the home visits that we do, we get to identify the child need, we get to identify the problems, the challenges that the child is facing in the home, and then we come back and see how best we can help the child. Also through the home visits that we do, we find that our children, some of them are sick. So from there, we help them get the medication from our center. So through the home visit, we also track the health of a child. And through the home visits that we go, we also sensitize our guardians and our beneficiaries on the importance of setting up TP taps and the importance of setting up dish rack. The importance of setting up TP taps is we are trying to let them know how to keep themselves safe, how to properly wash their hands, and it's not only them to do that. So through them, they can tell the community at large on the importance of setting up TP taps and washing hands, and the importance of dish racks. We are encouraging our children and our guardians to wash their dishes properly and air it in the sun so that it can dry well. And by doing this, it reduces the chances of our children contracting waterborne diseases like typhoid, like cholera, and any other diseases that come out of due to poor hygiene and sanitation.
Thank you, Spacious. Thank you. And now over to Riziki, who's one of our peer educators.
Hi, my name is Riziki Hamisi. I'm in Form 3. In 2018, I was recruited as a peer educator by the Nasio family. And as a peer educator, we usually create information and awareness about HIV, AIDS, STIs, teenage pregnancy, and drug abuse. We are comfortable offering peer education because we would like many peers to make the right choices and live healthy. And we were trained many peer educators and usually work in group. The benefits of peer education: firstly, it has enabled me to gain that courage to talk to people openly about sex, which before peer education, I used to be shy. Another one is that it has enabled me to change the life of many peers because they now understand how to control themselves by the use of the 3 C's. That is the choice, challenge, and the consequences. It has also enabled me to change my community, whereby our community, many children used to take drug abuse without the knowledge. But through the training, my community has changed for good. And also, the knowledge that I get in training, it has benefited me a lot because I can now avoid myself in engaging in early sexual activities, in early marriages, and avoiding drug abuse. Thank you, and we really appreciate for supporting us.
Thank you very much, Riziki. Incredibly courageous what you do. And Lillian, I think you're going to tell us a bit more about peer education, but also about our tailoring, I think. Thank you.
Okay. My name is Lillian Atieno. I'm in Form 3. I joined Nasio Trust Youth Tailoring Project in May 2020. As a tailoring trainee, I can now make clothes like dresses, skirts perfectly, which I was unable to do before. As a tailoring trainee, we do make masks and distribute to the vulnerable people in order to reduce the spread of coronavirus. As a tailoring trainee, it has led to reduction of idleness, whereby if there was no tailoring activity, most of the children will have been loitering around because they have nothing to do. Apart from that, we have also challenges like due to fears and threats posed by corona pandemic, most of the parents have refused to allow their children to come for training because they fear they might be infected by the disease. Because of the restrictions that have been put of staying at home, most of the number of the customers have reduced rapidly, and I'm very thankful to the Nasio Trust Youth Tailoring Project.
Thank you very much, Lillian. Thank you. And now we're going to hear from Josephine, one of our guardians and also one of our community health volunteers, talking about the importance of children's education. You okay there, Josephine? Your front row seat now.
Hi.
Hello, thank you.
Thank you very much. My name is Josephine from Mumias, Western Kenya, Kakamega County. I joined Nasio Trust in 2007 after my husband had passed away in 2006 of HIV. And according to the traditional, I had been forced to get to remarry within the family. But after remarrying, I found out that that man could not take my children to school. But I had noticed the importance of school, and I chased that man away. And that's how I was introduced to Nasio Trust in 2007. I'd like to talk about the importance of education. The importance of education, one, is that it will help enable our children to pursue different careers. Careers like a child after learning can decide to become a teacher, a pharmacist, or even a doctor. Secondly, the importance of education in our children is that it will have to enlarge, to enlighten, and to expose. It will have to expose in that by the time they're at school, they will have to learn about these traditional issues, which they can do and which they can do. It will be up to them to make a choice. And thirdly, by the time my children were introduced to Nasio Trust, I really thank this program because my children were not at school. I am the mother, and I'm very proud of the mother of Riziki, who has just been on the ground, because in the community, she has been empowered. She can talk freely, she can guide others, she can even talk without any fear. And lastly, I thank Nasio Trust as a guardian, because during this pandemic, COVID-19, children are at school, the teachers are there, they provide with them with food, education. These children are not idle. Compared to those who are not at Nasio, I'm very much worried as a parent, what will come that is by the time they will be needed to go back to school. I'm worried most of them will not report back. And I continue thanking you very much for your support as a CHV in Nasio Trust, whereby I have joined CHV this year, this is 2020, and I'm able to guide and counsel all boys and girls so that they may know the need, the importance of education in their lives, because on this world, without education, you are nowhere. Thank you very much. God bless you.
Thank you, Josephine. Very much agree. Without education, we are nowhere. Fantastic. Thank you.
Thank you very much.
We're now going to hear about one of our new programs, the Bike Repair Program. And Leonard and Vincent are going to talk to us. We're going to start with Leonard. Thank you.
Hi, I'm Leonard Wamkoya, a Form 2 student and one of the beneficiaries of Nasio Trust Youth Project of Bicycle Repair. And I'm here today to share with you the benefits that we have encountered in the project. First of all, the first benefit is that it has made us to acquire the knowledge and skills on how to fix the bicycles, as one of us can dismantle the whole bicycle and fix it the way it was. Secondly, it has enabled us to avoid idleness, as we are just busy the whole time, and also avoid making us to quit out from such things that may lead us to be exposed to the COVID-19. And thirdly is that it has also enabled us to know how people from Juakali industries struggle and survive in order to cater for their needs. Also, it has also made us to realize that in this world, without putting hard work in something that you are passionate, you will have to struggle. So we are doing best as we can so that we can pursue in what we are doing in the project. Lastly, it has also enabled us to have negotiation skills, as we can negotiate with our customers effectively and know how we can handle them in an effective way. So I just want to thank you all for supporting the project, and may God bless you.
Thank you, Leonard. And Vincent, if you'd like to add your comments, please.
Hi, I'm Vincent Mumia, and I'm a student in Form 2, and I'm here to share with you the benefit of Nasio Bicycle Repair Project. The first benefit is that it has enabled me to gain confidence and courage on how to talk with people, since you have to talk well to customers and convince them to come another day. And the second is it has enabled me to learn that in life you must be dependent to yourself so that you can live better lives. I thank you for the support to the project. Thank you.
Thank you very much, Leonard. Thank you, Vincent. Thank you, Leonard. So now we're going to actually hear from Chantel in our UK office about our child sponsorship, while we give the Kenyan team chance to move, and we move on to Jack next. So Chantel, could you please share the benefits of child sponsorship with us?
Hello, my name's Chantel McDowell, and I work in child sponsorship in the UK team. Firstly, I'm also a child sponsor. And how I became to be a child sponsor was my daughter actually travelled out with a youth group. So we decided to join the sponsorship programme and started sponsoring a little girl. My daughter was actually able to meet her when she went out, which was amazing. I then started volunteering with the Nasio Trust and then started working in the office. So as a child sponsor, I believe that the sponsorship programme is life-changing for the child as well as the sponsor. It definitely has been for me. The children are then able to access the schooling, education, medical care, as well as lots of other things. And child sponsorship has been specifically very important this year due to COVID, because due to the sponsorship programme, we have been able to support the children from not going to school so that we are able to set up programs for them to still attend, tailoring projects. They've had music lessons, lots and lots of different sessions that they've been running to keep the children busy and safe And so the team have been absolutely fantastic, especially during the COVID. I was lucky enough to visit Kenya myself in 2019, and it was definitely a life-changing trip. And others that have been would say the same. Once you've been, you want to go back again and again. And also, you know, I hope to go back again soon, and I'm sure there's so many people that would definitely like to go back. I must say that my favourite part of the job is receiving the updates on the sponsored children and seeing the pictures, and also receiving the pictures of children with their donations that the sponsors or people have donated for, and receiving the pictures. Yeah, it is just such a really good part of my job. And I'd really like to tell you about the alternative gifts, where people are able to purchase these items for either a specific family or for the most needed family. And then when you receive the picture back showing the child with a bed you may have bought them, or, you know, a food parcel, just showing you what things that we take for granted that they really, really appreciate. So yeah, the alternative gifts have been a really fantastic and life-saving thing for all our children and families. So thank you to the sponsors and all the donors as well.
Thank you, Chantal. That's fantastic. I see we have managed to change teams in Kenya. We're obviously limited by one room and one webcam in Kenya, so things are a bit different for them logistically. Ian, can you unmute again so we can hear from Jack and the rest of the team? So I think we need to get you guys unmuted. And I think the next person we're going to hear from is Jack, who's responsible for our agriculture program. So Jack, over to you.
Yeah, I'm fine, I'm Jack. I must say on the farms we are, hi, how are you? On the farms we are progressing on well. We are taking care of growing crops for the consumption of our children. We grow food crops, we grow vegetables to supply to our schools for the consumption of our children. We also support the local community in terms of farming activities. This year we had 514 farmers whom we support, and 90% of them, they had enough food for their supply in terms of their families, and then the surplus they sell to earn income. We also grow trees. We have a tree nursery where we supply trees to the local community, especially the guardians, and whatever is excess we sell to generate income to the organization. We're also involved in fish farming, where we want to diversify in terms of what we get in terms of food supplement to our children. We also have a dairy animals, where we have milk, which is consumed locally to the schools. So basically, the farms, we are an all-round organization where we practice what can help the kids, what can help the guardians, and what can help the local community. We're also encouraging our young children to work on the farms, to acquire some skills on the farms, how to plant vegetables, how to weed crops, how to harvest, so that at the end of the day, they can also be able to come out and have skills on their own when they go back to their families. So in a nutshell, that's what we have on the farms, and I think we are pushing on well as far as our local production is concerned. Thank you.
Thank you, Jack. Fantastic to hear about all the good work for the farming. We're now going to move across to the medical centre. So we've got Godfrey, who's going to talk to us about updates for the medical centre. Thank you, Godfrey.
Hi. Okay, I'm Godfrey Ludenyo. I'm a clinical officer by profession. I joined Nasio in the year 2018 as a healthcare provider. At the onset of COVID as a pandemic, we have the impact that we made to the community in Kenya, the western part, Mumias West. First thing that we've done is the sensitization. We've done the creating of awareness to the community through health education to clear aware about the myths and misconception about coronavirus. We've taught about what is coronavirus, means of prevention, signs and symptoms, and part of management to the community for them to understand how to prevent coronavirus. Second thing that we've done the sexual health education. We've done family planning to the community. We've also done distribution of condoms. Due to lockdown, we find that most of the families are back at home. So as a way of operation control, we did the distribution of condoms. Also, we've done the gender-based violence advocate because there was a increase in gender-based violence. We also did the sexual transmission disease infection prevention by teaching the community. And the last thing we also did, it's about education them about the teenage pregnancy. The third thing that we did as the medical center, it's about waterborne diseases reduction, whereby we have seen 78% reduction of waterborne diseases like diarrhea diseases, typhoid, amoebiasis, cholera, and helminthiasis. I think that's the part we've done as a medical team.
Thank you very much, Godfrey. Great to hear. Fantastic results. Thank you. And so Caroline's going to talk to us about our maternity cover at the hospital. Over to you, Caroline.
Hi. Hi. Okay, I'm going to talk about, my name is Caroline. I'm in charge of the maternity department. I'm going to talk about how we are keeping our mothers safe due to COVID pandemic disease. First of all, I'll talk about health education. We've been giving our mothers health education on the measures on how to prevent COVID whenever they come for delivery. First of all, we teach them on the hand washing, the use of masks, and also the techniques of hand washings. After discharging our mothers at the maternity, we also advise them on the importance of measures at home, in that we also teach them on the preventive measures and the hygiene measures. Secondly, we've also created sensitization within our community, and this is we've been doing through our community volunteering, who has also enabled us to sensitize our mothers who want to deliver, especially at home, the importance of delivering in the hospital, and also the impact of delivering in the hospital due to complications that may arise at home. In the month of July is whereby we had a reduction, whereby we didn't reach our target. Our target per monthly is usually 35 delivered mothers. In that month of July, we had 29 mothers who delivered. So we saw it as being affected by the pandemic, COVID-19, and this was due to, I think it was due to our mothers feared coming into the hospital. I'll also talk about immunization. In the immunization system, we also give our mothers immunization, and we've noticed in the same month of July, we had a reduction of our mothers who were coming for immunization. So we were at 70%, not 100%. Thank you, and may God bless you.
Thank you very much, Caroline. And finally, our final speaker is Berta, who's going to tell us about our spirulina production. Thank you, Berta.
Hi. Okay, I'm Berta, in charge of spirulina. Spirulina is a food supplement which has got a very high content of protein. And initially, we were producing low quantity, 4 kgs. And currently, we had the merging of tanks because our tanks were too small. Now we have big tanks, whereby right now we are harvesting 5 to 6 kgs monthly. We also have beneficiaries of Nasio, whom we feed spirulina. We have 17 children of St. Irene and 3 guardians. Noah's Ark, we have 10 children and the 3 children under 1 year who are outside the project. They also benefit from that spirulina. We also have, as I had said in the first, we have external mini markets. We have 5 agents who are also supporting us in sales, in selling, in terms of sales. And we also go outside the community to sell. We also work in the community to educate the community members to know the health benefits of spirulina, and they come to buy. We also have exceptional students and volunteers whom we teach spirulina, and we are progressing on with that training. Right now, they are carrying on well. They know what spirulina is. They work in the community and teach more about spirulina. So they are also sales agents of spirulina.
Fantastic. You've had a comment while you've been speaking, Berta, from Sue. She says, wow, Berta, that's an increase of spirulina even from last year. Well done, Team Green. So there you go. There's a live comment from your audience. Thank you very much. So great work, team. Thank you very much for all of those presentations. We've had a few questions come in already, so I'm going to pass these across. So first of all, Neil had a question about the fish farming. So this is one for Jack. Do we have Jack still? Where are the fish farmed? Neil wants to know where they're farmed. He's asking if it's in tanks, rivers, or the Lake Victoria. So can you say a bit more about the fish ponds and where they are?
We have made some fish ponds. So that's where we farm our fish.
Yeah.
We collect some water from the nearby river, and then we have made some ponds where we are growing our fish.
Definitely.
Currently, we have 2 ponds where our fish are being farmed.
Thank you, Jack. That's great. We've got some more pictures we could post on social media. We'll definitely put those up. Some more pictures came in this team of the ponds, so you can then see this. They're quite big, aren't they, Jack? How big are they?
Yes, there are 2.
Ah, yes. And Harry's saying they're behind the guest house, the fish in the ponds. Yeah. Okay. So another question. We had quite a lot of thank yous. So Mercy from Kenya sent a great thank you for everything and all the work that you do. So many thanks for educating and hosting the most vulnerable and marginalized children. A big thumbs up for the agricultural program and educating communities on farming. You literally help put food on their table. And your clinic is saving lives and speeding up efforts to advance maternal and neonatal health. Asante sana. So that's from Mercy. Thank you very much, Mercy. Kath had a question, which is for Leonard and Vincent about the bikes. So how many customers do you have you had for the bikes so far? Can we have Leonard or Vincent answer that one?
So far, we have encountered 510 customers.
Say that again, please. How many?
510 customers.
510. Wow. Brilliant. That's fantastic. Thank you very much. There's a couple of more. I'm just going to check that I'm catching all of them. Gareth asks a question. How many children do you fear will not return after the pandemic to school? So I know we're worried, and quite a few people have mentioned, we've mentioned all the activities and programs we're doing to keep engagement of the children. This may be one for Spacious, perhaps. Do we have, or for Ian? How many children are we worried about? What do we feel? Can we answer that one? It's a hard question to put a number on, I suppose, but are we really worried about some children? Can't see Ian or Spacious. Yep. What do you think?
I'm here.
We're keeping in touch with children, aren't we? We're keeping in touch with children to make sure they come back to school and re-engage. Are we worried? So are we worried about children coming back? And if so, many of them?
Currently, what I'm in response with regards to that question, I may say we are not so much worried because already we are engaging our children in community-based education, something that had been championed by our government, our Ministry of Education, but later on stopped due to the surge of the pandemic. So we are just waiting for schools to reopen, and we are very much ready to at least shift to maybe the new system that will come on. Currently, we are looking forward to opening schools officially next year, January, from 4th. But currently, we also have a candidate class that is also going on. So we are very much ready for that. And we just appreciate, because as we engage our children in these various activities of tailoring, farming, name them, there are many. We are still holding them, and we have really retained them, and we are not worried about giving them back to their respective schools.
Okay, thank you. And Sue's also asking a clarification question. Will all of the children be repeating the year they left, because the schools have been closed so long, haven't they, Ian? Is that the plan?
With regards to the new timetable that the government has just communicated, we have a class that will be moving next, but there are some that will be repeating. So it's something that we have to really go by the government's guidelines on the same. So we have to accept that there's a group that will move on to the next level, but there is that one that will again be repeating. So we shall also be going by the merits of our students, so that we ensure that we are able to field competent learners. Our intention as Nasio Trust is to ensure that we produce quality servants, we produce quality students that will be able to compete well in the world.
Yeah, no, thank you, thank you. Okay, we have a question from Anne. Have the numbers of mothers gone back up to pre-COVID levels in the medical centre? So this will be one for Caroline. So you mentioned there was a drop-off of people coming to the hospital for treatment for delivery. So Caroline, have they gone back up again now?
Pardon, come up again.
So you mentioned that the number of mothers delivering in the medical centre had gone down in the summer. The question is, are they starting to come back up again? So are you meeting your targets lately with regards to the deliveries?
Yeah, okay. Right now, with the use of our community health volunteers, we are now meeting our targets. Like in the month of August, we were at 39. In the month of September, we were at 44. And in the month of October, we were at 40. At right now, in the month of November, we are at 23.
Okay, great, good to hear. So people's confidence is coming back up. And there was a comment, and it's a good comment, well made. I think Ron mentioned you're all sitting very closely together. I just want to say we haven't been able to manage social distancing with the logistics of this. We have one webcam, one laptop, one room, but please be assured everybody will be sanitizing thoroughly afterwards with their masks back on now that they've all finished speaking, and they will be doing all the sanitization. But obviously, in order to be able to share, we wanted you to see a lot of the team, not just listen to me or to Nancy. So I think on that point, Jonathan, are you saying happy birthday to Nancy? Does that mean that I didn't actually know it was my boss's birthday today? Is that right? Is it Nancy's birthday today?
Yeah.
Yeah.
Ah, happy birthday, Nancy. I think I didn't realize that. Happy birthday. We'll get some embarrassing posts on social as soon as we can, won't we, Harry? We will get that done. Happy birthday. And for that, I've got a couple of really tricky questions that I think you need to take now, Nancy. One of them from Grace, really excited about the opportunities of visiting, but the question is, how can Western volunteer tourists really make a difference in a few weeks without being tokenistic? So can you talk a bit about our volunteering program and the impact that Westerners can really have for Nasio?
Thank you everyone for joining us. It's a very interesting question, but also what I always say, unless you understand the problem, how do you solve it? So we encourage people to understand their neighbors' problems wherever you are in the world, your community problems. You start with your family, your community, your village, your country, and then globally. And however short your visit is, interesting enough, I've always said, even if you have 3 days, it's enough for you to understand global problems and be able to be part of the solution. So yes, I would highly recommend, if you have time, travel the world and see and understand problems. And you don't become a token, you actually become part of the solution.
Yeah, no, absolutely. And this one, I don't think this one is answerable, not even by Boris Johnson or any Prime Minister, but I'll let you answer it, Nancy. How long before Nasio have the COVID-19 vaccine? How long will we have to wait when there's a vaccine, do you think, for it to reach our community in Kenya?
I mean, it's interesting, we're waiting for it, but to be honest, even at the moment in Kenya, there are no testing kits. We've run out of testing kits. So the numbers, we know the numbers are low, but that's just because no one is testing everybody, or no one has access to the tests. So if we can't even test, I think we'll be the last ones to get the vaccine. I think the vaccine will only come when it becomes available in the West and everyone else in the West has had it, because they either want to travel, they want to have the freedom, then we will get it. So I think we'll be last, but I might be wrong, because I know in Kenya, they're also trying to, there's KEMRI, which is the research center, also trying to find a vaccine. So we might be fast to get it.
Fantastic. We don't know, do we? I'm just scanning. I don't think I've missed any questions. There were some lovely comments. So Lucy, thank you very much for your lovely comments about volunteering trips and the impacts it's had for your family, and also the alternative gifts, and how receiving the photographs was really special for you. So thank you very much for your support, Lucy. That's great to hear from you. I think I've got through all the questions, which is actually really, anybody got a final question that you want to type that I might have missed? I think we've got through them all, but it's great to see the engagement and to get your questions. Thank you all very much for that. We wanted, before we finished, to have a chance to share with you our video for our Christmas appeal. And then straight after the video, I'm going to hand over to Nancy, because one of the things she wants to close with the closing comments, the birthday girl would like to share, is about the importance of what we're doing for our Christmas appeal, but also obviously have a chance to thank you. So let me just share my screen, and this has worked multiple times in practice, so let's hope it works now. Here is our Christmas appeal video. Thank you. So if I can hand over to you, Nancy, to close the meeting and to find some final words. Thank you.
Thank you. First, I just want to say I am so blessed to have such an amazing team. I mean, you can hear how much passion and commitment they all have for their jobs, their community, and I'm just so, and our children who are incredible. I'm just so proud. But also Nasio has so many functions, and to have so many people. I mean, in Kenya, we have over 89 employees, and to have all 89 employees just really doing their job to save their community is incredible. But also our supporters, thank you so much for taking your time to listen to us, because we were blown away by the interest from the interest on people wanting to join. But what I was going to say about is when I arrived here and had the first lockdown here, the first thing I noticed is some people are so poor that they don't have radios, they don't have televisions, they don't have mobile phones, they don't even have electricity. So they were completely in the dark about COVID, completely. In fact, when we started doing the sanitization in the towns, they just didn't know what we were talking about. And that's why this Christmas, we thought would be very different. Let's make sure that every single household, every single family we support can get an update information on the numbers, the sensitization, what they should do to protect themselves. And that's why we decided to come up with a wind-up radio, because it's a wind-up radio. It means that they don't need electricity or they don't need to buy batteries to be able to get them. So the idea is that we need to get at least up to 400 radios so that we can save. It is a life-saving tool for these families. But one of the most important things I thought I want to talk about, you might have seen me taking photos, because I want my team to share that experience, because they're in the moment talking about it. So I'll share the photos with them and the ones who could join us. But I've also realized that it's so important to have food on our community tables, on our families' tables. And that's why the agriculture department is so important. We are trying to empower small-scale farmers. That's the only way we'll have food security. If we make sure that every single farmer, however small the piece of land is, they're able to plant vegetable and they're able to plant maize to have a staple food. Because when they have food, we know the children are less likely to be malnourished, they have better health, and they stay in education. And so that's why Jack talked about 500 farmers being registered. And this year our target is to get up to 1,050 farmers registered through 1 Acre Fund to get food on their tables by next year. And that will make a massive impact. Climate change is another big thing. If you also had Jack mentioned, we are planting trees every single month. To date, up to this end of this last month, we planted over 4,000 trees because we really care about the environment. But we also noticed that for the first time we were flooded in the area. I grew up in this area and I never ever heard of floods. But for the first time, over 400 people and families were displaced from the floods. So we know that whether we like it or not, climate change is coming, it's affecting us, and we are also making sure that we are part of the solution. And the solution is let's plant more trees, let's understand how we use the soil, the erosion, and also just making sure that people are aware of the environment. And in a way, I'm so proud of Kenya as a small country. We're one of the first countries to ban the use of plastic bags. So we don't have plastic bags. If you're found with a plastic bag, you're arrested. And surprisingly, when I arrive, I'm just shocked that before they banned plastic bags, when I used to drive around on market days, all these plastic bags would be on trees because the wind, everyone on the market would have been having plastic bags and the wind would have blown them on trees. And so that's gone. So I'm really, really proud of my country, the fact that they're one of the first countries to ban plastic bags. So we're much, much aware of the climate change. Now, COVID has also created an economic gap between young people, women, men, urban and rural. But mostly I'll talk about our young people. We realize that being out of school with no internet, no homeschooling, nothing, they're completely cut off education. So that's why we've started life skills. And Lillian talked about tailoring, and she makes her own clothes. If they're torn, she fixes them. So she's learned something. And we've also said, you know what, if schools never ever open, or if they do open and you choose not to go back for whatever reason, we can buy you a sewing machine and you can start making money and earning an income. Agriculture, fixing bikes. You heard Leonard and Vincent talking about they can fix bikes, but it's not just fixing bikes. They're also confident about talking to customers and customer care, and also realizing that if we don't talk well to people, we can't sell, because communication skills are key. So we're teaching these kids life skills, saying, you know what, it doesn't matter how long it takes to go back to school, keep yourself busy, but also learn a skill that will help you. And it's so important to see Josephine, a mother of Riziki, a mother who was widowed, was forced to marry because of the culture. Because in this culture, when your husband dies, you're inherited. It's a must. That night, the night you bury your husband, your brother-in-law moves in to your house. He becomes your husband. No choice. You have no choice. You can't choose which one of your brother-in-laws you'd prefer. They decide which one comes to move in, and they become your husband. And Josephine, you know, I was just horrified when she was saying, you know, her brother-in-law moved in, but he was a drunk and he couldn't even provide for her children. When she would ask for food, she'd be beaten up. And to see her championing the importance of education to other parents and children, because I always say even today, I was talking to the medical team and I was saying, look, we are all sat here because someone cared about the importance of our education. We're all sat here because of that. And therefore, we will do what we can to make sure no child drops out. However, even now, we've had some who don't turn up even to the activities. And the social team was saying, Nancy, we've followed 3 times. They don't come, or they go, because in Kenya, again, every single day is a market day. So you have a market day here, let's say in Abingdon, you have a market day in Whitney the next day, you have a market day in Oxford. So some of these kids are going to markets because they're being used for economic reasons. Their parents are saying, well, there's no school, so I want to go to the markets. You can earn an income for us to buy food. Now, once that child gets used to going to the market, there's 2 things. 1, they get used to handling money. 2, the parents get used to them being the source of income. So when it comes to going back to school, the chances are the parents will say, well, why are you going back to school? You've been the breadwinner. So we're trying to say, okay, what can we do? And the social work team said, we followed up 3 or 4 times. What do we do? So we know, and Gareth, you asked that question, we know that however much we try, unfortunately, we might lose some children for that reason. They might end up being the economic breadwinners of their families, or they might end up being married off or sent off to city. If you're a girl, they usually send you off into the cities to work as a house help. To me, that's still child labor because you're still a young person, but it is happening. And the culture of being married and inherited still exists. That's what Josephine said. I want girls to be educated enough to have that choice where they can say, no, I'm not going to be inherited. So what these teams are doing is incredible. It's just beyond keeping people safe and giving them food and an education. But also the gap for young people, I worry globally. Economically, if you've not been out of school and not had any education for almost a year, you cannot compete on the global platform. They're never going to compete with kids in the West who are already in school or have been doing homeschooling or have been using internet. So we are saying, okay, we will have to work with what we have. We'll have to teach you life skills because that will keep you, supporting yourself eventually. And if you go back to school, well enough. So that's one of the things we're doing, which is a part of the COVID impact. Now, health is very interesting. When people are not healthy, they cannot work, they cannot look after their children. And the medical team do an incredible, incredible job. And today we were saying we are praying that none of them gets COVID because we know doctors are in Kenya now dying of COVID, but we're trying to make sure that we stay safe, we keep safe, but most important, in fact, they said we need to have a prayer day where we just pray for them not to get ill. But most importantly, we are also making sure families have health insurance. It only costs £5 to insure the whole family a month. So we're saying we must make sure these families have access to health insurance so they can be able to access basic health care. Because we know if they're healthy, they will look after their children, their farms, and they'll be able to be contributing to the community. So health is important to us. And it's so nice to see that even with the sensitization, waterborne diseases have dropped. People are washing their hands because we are teaching them how to wash their hands, building tippy-taps, and sanitation is a big thing. We're building toilets for families. We're repairing water, hand washing, sanitizations for schools, because we also want to change behaviors so that even after COVID, let's keep waterborne diseases at bay. Let's keep them down because it's basic hygiene and we'll continue doing that. The other one is empowering women. We know the gap now, economic gap, education gap, between women and men is still very big. So we are now starting adult education lessons for the adults, especially those who never went to school, making sure they get basic numeracy and literacy, but also making sure that we do table banking. We've, one of the groups of the guardians, they're starting to meet every Thursday. They're starting to put money together, learning how to bank, how to take loans, how to pay the loans back, how to invest that money, so that we can empower them and reduce the gender gap between men and women. Because we also know at this area, at this time, the average lifespan for men is 35, for women is 45. So we're trying to make sure that if women are going to be left to run their society or the communities, let them be empowered to be able to do that economically. We're also creating employment. We are at the moment one of the biggest employers in the area. We have over 89 employees and a lot of young volunteers, up to almost 10 volunteers who are not in college or finished college, who are volunteering with us. So we are creating employment in whatever we do. Team Green have some of the volunteers working, the Tree Nursery have guardians working, and it just means that people can earn an income to support their families. The peer education program, I cannot emphasize enough. I said to Riziki, when I was 18, there's no way I would have stood in the middle of a market town and hand out condoms to older men. There's no way I would have done that. No way, not in a million years. But they're so confident. They go out and they speak to people and they challenge them. Even on their t-shirts, on the back, they say, ask me about sexual reproductive health. And she made me laugh because she said sometimes when they go out on these markets, people are so rude to them. They say, oh, I haven't got a girlfriend. Why don't you come and teach me how to use the condom? And I said, so what do you do when you, what do you do when they say that? They say, well, maybe when you need to teach us the safety skills, how to protect ourselves. But they also say to them, look, that's why we're teaching you, so that you don't use, you don't infect young girls or get them pregnant. So our peer education program is so important to keep our children safe, because we know if you educate a girl in Africa, they are less likely to get pregnant as a teenager. They're less likely to get married young. They're more likely to get a job and have less children, because they're so empowered and they are able to break the cycle of poverty for themselves and for the next generation. And so what we're doing is to make sure we continue sensitizing our communities about COVID, teenage pregnancies, empowerment, farming, all those things that will really get us all breaking the cycle of poverty in Kenya. So thank you so much, my team. I am incredibly proud but humbled to have such an amazing team of people who are so committed, and also our supporters. Without you, there's just no way we can change lives, support communities, keep children in school, feed them, and also just be able to do what we do. So thank you very much. So we will just toast. If you have your cup of tea or water, we'll give a toast to everybody and pray that you all stay safe, you all stay well, and may we keep safe, all of us, so that when it's all done and finished, we can celebrate and thank God for what we're doing. So thank you very much. I am so grateful. Thank you.
Thank you very much, Nancy, and happy birthday.
Thank you.
I wonder whether this is possible. My technical skills may let me down, but could I take everybody off mute and could we try and sing? Let's see, hang on, if I can do this. I may not be. Ask all to unmute. So if you have to unmute yourselves, I've asked everybody to unmute. If you unmute yourselves, can we, let's go to a gallery view. And I don't know whether John, you were trying to do something special. Did you manage it?
Unfortunately, I'm waiting for an essential part, hasn't arrived.
Okay, no worries.
I can do a virtual one. We'll go with a virtual one.
We'll go with the virtual one. So John was going to try and hold up some candles for you to blow out, Nancy, but obviously we didn't get that far. So we'll try and sing. And where is John Cornelius? He's the singer among us. I'm going to start then. Hey, we've got virtual candles. There you go. Nancy, blow out your candles. Happy
birthday
to you. Happy birthday to you.
Happy
birthday,
dear Nancy. Happy birthday to you.
Thank you. Thank you, everybody, for joining us. We have recorded this session, so I know some people had issues getting on, but we will make sure that we share it. So thanks again, everybody. I hope you enjoyed the session. Really appreciate you joining. Thank you so much for your support.
Unless anyone has any question.
Yeah, we're not going to ask you how old you are, Nancy. No.
Doesn't know.
Any final questions before we go?
Marie, can you put everybody other than Nancy on mute?
Oh, hang on. Mute all. Nancy will have to unmute herself. Hang on. Mute all. Nancy, you need to unmute yourself. What about you, John? I'm asking you to unmute, John. Okay, you ready?
Thank you. Nancy, if you could just say something so that you get the picture to you. And Marie, can you spotlight? Do you know how to do that?
Oh no.
Speaker, hang on, I can pin.
Oh!
We managed to get them lit.
Hang on, I don't know how. I haven't managed to.
Okay, don't worry.
Pin. I'll spotlight for everybody. Hang on. No, I'm doing the wrong person now.
You need to do Nancy.
Hang on.
And me.
Foster. You're asking me to do too many technical things all at once here, John.
Okay, don't worry.
Hang on, no. Where's Nancy gone on my picture? I can spotlight you.
I'll do me and then do Nancy.
She's it was all going so well, right? So
it's all fallen apart.
Spotlight for everyone. Continue. Okay.
And then Nancy as well.
And then spotlight for Nancy. Oh, add spotlight. Yeah. Okay.
Okay, Nancy, big blow.
Thank you very much, John.
Sorry, that was a bit impromptu.
All the best. Have a good rest of the day. Thank you for joining, everybody. Bye-bye.
Thank you all.